In late 2011, I felt a lump in my breast and I saw a doctor, and about 3 months later we found out that I had breast cancer, stage 3C breast cancer, and bilateral mastectomy was inevitable. And you don't know what's going to happen until you actually have it done, and once you have it done, then you start dealing with, wow, this is my new life, this is my new body. Having your breast removed is a constant reminder that you're sick. It's not just flat, it's flat. The worst part about being diagnosed with the BRCA2 mutation is knowing that it's possible it could go to my daughter. She had to be tested, and sure enough, she tested positive for the BRCA2 mutation.
When I found out I had the BRCA2 mutation, I was newly engaged, college student, trying to help my mom beat cancer, and I knew a double mastectomy and reconstruction was my best option, and it was really scary. It's like having your whole future pulled out from underneath you all at once.
Plastic surgery in the eyes of the lay public is often thought of as cosmetic surgery or vanity surgery. The reality is oftentimes the reconstructive surgery deals as much with function as it does appearance. Breast reconstruction for women facing loss of the breast through mastectomy is one of the more emotional situations that plastic surgeons deal with. It allows a patient who undergoes breast reconstruction to be able to appear more normal in public, to feel more confident. It allows them to resume a more normal life.
Microsurgery is a technique, and it also is a specialty, but essentially what that entails is using strong microscopes and very, very fine tools to bring back together very tiny structures, oftentimes blood vessels. And it really has revolutionized breast surgery and breast reconstruction.
Women who are faced with a diagnosis of breast cancer and they need a mastectomy, they need not fear that they will be disfigured. By utilizing the tissue in the lower abdomen, we can actually transplant that and provide soft, natural, warm-feeling breast. And the second advantage of this technique is that it allows women to lose some of the lower abdominal tissue that they've gained over the years, and it's an extra bonus. They get a tummy tuck in the process.
After having reconstruction, I realized it was amazing. The people at Plastic Surgery Northwest did everything they could to make my transition to normalcy amazing.
I knew I had an 87% chance of getting breast cancer in my lifetime if I didn't have a mastectomy and reconstruction. And seeing my mom do so well with her surgery and reconstruction, I knew that that was just the decision I needed to make.
Breast reconstruction surgery has really developed into my passion because it allows me to give women back something that I think is so important for their lives. And being able to provide patients with something that makes them feel like themselves again is one of the most rewarding things that I can possibly do.
Here at Plastic Surgery Northwest, we're a group of specialized microsurgeons. What's different about us is that most practices in plastic and reconstructive surgery don't offer microsurgical breast reconstruction, and we've been doing so since 1994. Initially, we were a group of only 2 microsurgeons, and now we're a group of 6 surgeons, all of whom are able to provide breast cancer reconstruction.
Insurance covers breast reconstruction, including any symmetry procedures for the opposite unaffected breast. There was a law that was passed in Congress in 1998 saying that insurance companies can't refuse to cover that. At Plastic Surgery Northwest, the breast reconstruction that we offer here is second to none in the country. There's techniques that we use that are very challenging, both from a caring for the patient afterwards standpoint, as well as the actual operation and how it's performed.
The way we stay informed about emerging trends in breast cancer reconstruction is by attending local and national meetings to stay informed on the topic. We also participate in weekly meetings to discuss specific patients and their total cancer care, and reconstruction is obviously a key component of this. We stay apprised of the literature and surgical techniques that are involved in providing the best options for patients.
I was diagnosed with breast cancer 4.5 years ago, and when I was diagnosed, my head was spinning. It was a very scary time. Well, my breast surgeon referred me to Plastic Surgery Northwest to find out about the different types of reconstruction. And when I arrived here, they were so wonderful. They were so accommodating. They made me feel like I was going to be a whole person again.
Here at Plastic Surgery Northwest, with the staff and the doctors that treat you like you are the only patient they have, it's amazing how you can recover from something as traumatic as cancer.
Pre-surgery, I was really apprehensive and nervous about what I was doing, but once I woke up from surgery, I instantly knew I had made the right decision, and Plastic Surgery Northwest supported me in every step of the way, and it was the best decision I could have ever made.
What I think all the surgeons here at Plastic Surgery Northwest would like patients to understand that a diagnosis of breast cancer doesn't need to be so devastating to them. That there are techniques that we offer to provide restoration of the breast, and so patients shouldn't be fearful. We hope that we can provide an atmosphere for them so that they can restore their lives and have their bodies restored as well.
To learn more, visit us online or call the number on your screen.